Tools for easing COVID-19 related anxiety, Part 3. I am Samantha Morris, staff psychologist at Student Health and Wellness Mental Health. In this series, we've been discussing anxiety that might be coming up for you right now during the COVID-19 pandemic. In Part 1, we talked about what anxiety looks like and some things that can be helpful, which moved us into Part 2, which was really focused on cognitive skills. And this is Part 3. So today we're going to be talking more about the behavioral skills that can be helpful. Tools. Here we have the CBT triangle: thoughts, behaviors, feelings. These are the components of anxiety. We already covered thoughts, thinking about skills that are helpful with changing thoughts. So we're going to move into behaviors. And as a reminder, all of these different components interact with each other. So working on one often helps to make the others feel better as well. Tools. Okay, so what are we going to cover? First, we'll talk about behaviors that are common when someone's feeling anxious, and then move into behavioral modification, which is ways of changing behavior to help you feel better. And then how do I apply behavioral skills to my life? Tools. So this first section is going to talk about behaviors that are common in anxiety. So you'll see there's certain behaviors that we see often when a person is feeling anxious. Tools. So this will be a little bit of a review from Part 1. We talked about some behaviors that we typically see when someone's feeling anxious. The first is avoidance. So this is when someone has fear or anxiety about a certain thing, and so they avoid doing that thing. So maybe someone has some anxiety about doing their online classes, and so they procrastinate and avoid doing the work, maybe by watching Netflix or going on social media. Another behavior, ineffective safety seeking. So these are attempts to create a sense of safety to make yourself feel better, but they're not effective attempts. They don't actually address the underlying anxiety. So this would apply to things like going out to stores and really stockpiling certain items that maybe aren't necessary. And someone feels better once they get home and have all these things, but a week later they feel like they have to go and do it again. So it's not really addressing the underlying anxiety. And then unhealthy coping. So this is trying to do things to ease anxiety, but the things that you choose to do possibly don't help or make the situation worse. So this might be someone who's drinking alcohol every night to fall asleep. They do fall asleep, but they don't get good quality sleep, and it's not a healthy practice. All right, so all of these things, as you may notice, they make a person feel better in the short term because they take away the cause of anxiety. However, in the long term, they have the potential to make the problem worse. So that's where we really want to think about changing behavior to things that also help ease anxiety, but in a more long-term and healthy way. Tools. This is a quote that I really like from Viktor Frankl. When confronted with a situation we cannot change, we are then challenged to change ourselves. So I felt this was really appropriate for what we're all going through right now. We're in a situation that has a lot of aspects we can't control. And when that happens, just in terms of thinking about our own behavior, I think it can be a challenge to say, well, what am I in control of right now? What things can I change? And using the time to really focus on helping ourselves, working on things that maybe we've wanted to work on for a while. So again, the focus of this presentation is changing behavior, and we're going to go through a lot of different ways to do that will hopefully help you feel better, anxiety come down, and maybe even make this experience feel more meaningful. Tools. So in the same way that cognitive behavioral therapy believes that we can change our thoughts, it also believes that we have a lot of power to change our behavior. And the first step in this is recognizing what are my patterns of behavior that potentially are causing anxiety to be worse. So really identifying those and whether or not they're contributing to feeling anxious. And if you do find that you have some of these behaviors, then moving into the behavioral modification skills. So that's kind of the step-by-step process of just starting this journey and really trying to change your behavior. This next section will talk all about what is behavioral modification. These are some of my favorite skills, and you'll see how they can really make a big impact on people's lives. Tools. Behavioral modification. So behavior modification is paying attention to your behavior and changing any unhealthy patterns that you might see. I've broken this down into 3 separate skills, and we'll get into each of these in more detail. So the first is graduated exposure. So this is meant to help counteract avoidance, one of the behaviors that goes along with anxiety. In graduated exposure, we face the thing that makes you feel anxious in very small steps. So it's meant to be a technique where rather than avoiding something, you have yourself face it in order to ease the anxiety. Next is staying safe. So this is just using ways of staying safe during this time that we know are effective. So keeping yourself safe, keeping your family safe, all in ways that we know have been proven to actually be helpful. And lastly, healthy coping. So this is to counteract unhealthy coping. So this is really just changing behaviors so that you're doing things that actually help you to feel better in a more long-term way. So the goal of all of these is to learn new patterns of behavior that are more adaptive or more helpful, and hopefully also decrease anxiety. Tools. So a little bit more about graduated exposure. You see a picture of a ladder there, and this is to really indicate that any kind of exposure therapy, as you may have heard of it referred to, is done in very small steps. So when you're fearful about something, it never makes sense to push someone to try and experience that all at once. We want to do it little by little so that no one feels overwhelmed. I want to make a little disclaimer here that exposure looks a little different than it would at other times due to the pandemic. So we're not pushing anyone to do something that wouldn't be safe. So I just want to say that. So exposure is the practice of facing what makes you feel fearful or anxious rather than avoiding it. An example of this might be, again, with online classes. You're feeling really anxious about those. And so you find yourself procrastinating work. And the way it works with avoidance, every time you procrastinate and push it back, you feel a little bit of relief because you've done that. But then in the long run, you feel more and more anxiety because more and more work is building up to a point where it starts to feel unmanageable. So avoidance is not effective in that way. With exposure, what you would do is just little by little start to face that task. So schedule a time to sit down and do just 20 minutes of work. And 20 minutes is better than nothing. At the end of that time, you'll feel a sense of accomplishment, and that will reinforce the behavior so that hopefully with time, you start to be able to do 30 minutes and then maybe 40 minutes and little by little get that work done. So that's the way exposure works. Tools. I wanted to give another example of exposure. So this is an example where someone is having difficulty exposing themselves to an emotion. So anytime someone tries to talk about COVID-19 or how they're feeling about it, you change the subject. So this is someone who just wants nothing to do with the anxiety that's being created around what's happening in the world right now. Maybe having a difficult time tolerating those anxious emotions. And by avoiding the emotion, maybe you don't have to experience it in the moment, but it's still there. And usually anxiety finds other ways to come out, like physical symptoms, for example, is very common. So the exposure, the graduated exposure in this type of situation would be to allow yourself in small ways to open up and talk. Maybe start with one person that you really trust and build from there. So just another example of how you can kind of little by little start to let yourself experience the thing you might be avoiding. Tools. Staying safe. So this is really focusing on what you can do right now, things that we know promote safety. So for this, I would really stick to reliable sources. So you see this from the CDC, things like staying home, avoiding contact with people who are sick, washing your hands, avoiding touching your face. So, when you have that urge to try and feel more control or keep yourself safe, keep your family safe, really sticking to the facts and the things that we know we'll do that. Tools. And the final piece, behavioral modification, is healthy coping. And as we see here, there are a lot of skills that fall under healthy coping. So I'll just go through some of these. You want to limit social media and news. So, if it's important to stay informed, that's great. But making sure that you're not saturating yourself too much with news. There's a lot of difficult things in the news right now, difficult things on social media. So trying to just limit that so that you're not feeling overwhelmed. Staying active, this is really important. Many of you may have more time right now and could potentially do a workout routine or some type of exercise or time outside that you haven't been able to do in a while. So, with time outside, just making sure you're maintaining the social distance and being safe, but it can be really helpful and really therapeutic to be out in the outdoors. Scheduling TV time, maybe making it more of a positive reinforcement or a treat rather than getting stuck binge watching something and then the whole day goes by and you're feeling kind of lousy. Sticking to your routine, I think this is really important. So having a morning routine, waking up at the same time every day, getting up, having breakfast, maybe showering, getting dressed, trying to make it like a normal day for you. If you might, be at school or things you would do otherwise if you weren't home, not seeing people. So I think this is really important just to stay healthy and keep your mind healthy, to just have a routine that you're doing every day. Eating regular meals, that goes into the routine as well. It's good just physically and mentally to be having regular meals. Picking up a new hobby. This is a great time. We have more time. You can, do things with music or kind of creative arts, things that maybe you couldn't do before. Try and stay social still, even though socializing looks different right now. So, there's lots of platforms where you can still connect with people, even if it's in a different way, temporarily. I think it can be really important to write down feelings. Journaling, might be really interesting to have a journal right now and to be able to look back in, 5-10 years from now and say, this is what I went through. I think it can help to make meaning from the experience and also just be a good source of catharsis and being able to get some of the feelings and thoughts out that you're having. And then different relaxation practices. So meditation, yoga, deep breathing, anything that helps your body and mind to relax can be really helpful with anxiety. And then lastly, finding purpose and meaning. So even though this is a really difficult time, I think we have the ability to control our response to that. So, trying to make some meaning out of this experience, even if it's really hard and in some ways you're suffering, your family's suffering, being able to make meaning from that experience can give people a lot of strength and a lot of resilience. So that's something just to think about. What will be different when this is all over? What will have changed? And what are ways that you can work on yourself during this time? Tools. Final section here, how to apply these skills we just talked about. Always a reminder, it takes time. So have patience with yourself as you move into this. Tools. So you're going to recognize these slides from part 2 because the aspects of how to apply this to your life are very similar to how to apply the cognitive skills. So mainly it's really important to remember that behavioral patterns have been around for a long time. We learn these early on, and it means that in order to change them, there's going to be a lot of upfront effort in the beginning. So they say to make a new routine, it takes a lot of work and a lot of repetition. But by the time you've done that for a couple of weeks, it's going to get easier. So just knowing that it's going to take energy and it's going to take a lot of intentional effort to start changing these things in the beginning. But with practice, it will get easier. Tools. And the fact that this is hard, it's really important to take things one step at a time. So maybe think about the ways that you want to modify behavior to help yourself feel better and choose just one thing that you're going to start with for this week. And make it something that is manageable. So keep your goals within reach, especially at first, because once you have some success, you'll have more energy to then move to the next thing. If you're going to try graduated exposure, just make sure you do it gradually. You never want to overwhelm yourself too much in the beginning, because if you push yourself too hard and you're not able to do the exposure exercise, then it often can make someone feel worse. So start with things that are manageable and just build slowly. So that's a reminder. And make sure to reward yourself. So this is hard work. Changing thoughts, changing behavior is really hard work. And I think any little time that you have success with that, I would stop, reward yourself, give yourself a pat on the back, and know that you're doing something really important. We've reached the end of the series on coping with COVID-19 related anxiety. I hope that the skills that were presented in this series can be helpful to you. Next steps are just taking these skills and practicing them at home. If you're looking for more resources and support, please check out our website at Student Health and Wellness Mental Health. Thanks so much for joining me, and I hope that you stay healthy and safe.